Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. A little later, some clips from Fancy Farm and an unintended consequence when the state legislature put the sales tax on some services. That's all coming up. But first, Kentucky's Commissioner of Health is here. Dr. Jeffery Howard oversees public health in the Commonwealth. That in itself will impress you even more when you hear his inspiring personal story. He's a native of eastern Kentucky who escaped tough circumstances, went on to Union College in Barberville, where he was an academic all-conference football player. Then it was on to medical school at Louisville, and then to Harvard's T.H. Chan School of Public Health. Commissioner Howard has devoted a lot of his efforts to dealing with Kentucky's top public health issue, the terrible opioid epidemic that took about 1,600 lives in the most recently reported annual numbers. In addition to those dying, it rips families and communities apart and puts an enormous strain on our first responders. Kentucky is also leading the nation in the cases of hepatitis A right now, and Dr. Howard knows very well the long-term issues facing the state that lead to high rates of diabetes, heart disease, and cancer. We welcome Kentucky Health Commissioner Dr. Jeffery Howard to Kentucky Newsmakers. We appreciate you coming. Thanks for being here.
Thank you, Bill. Appreciate the opportunity to be here.
You really do have an inspiring story. So let's talk a little bit, first of all, about your upbringing and the connection that really has to some of the issues and challenges that Kentucky's facing right now.
Well, I think first, I want folks to know that I'm an Eastern Kentucky guy. I love Eastern Kentucky and think the best people in the world live in Eastern Kentucky, and that's where my grandparents still live, and I visit at least once a month. Growing up in Eastern Kentucky, my mother and stepfather both were addicted to substances, particularly Oxycontin, a drug that's become infamous in Eastern Kentucky. And we saw the ups and downs of that issue. In fact, we moved from trailer park to trailer park. I was in 5 different schools before I was in 3rd grade. And so I thought it was important to share that story with my fellow Kentuckians, to let them know, I've been successful. I've had a lot of help along the way, but I've been successful. And it was because of that help that I was able to have success. But I want them to know that other people have been through those issues, and that I think it's important that we share those stories with one another, because this outbreak, this epidemic tends to isolate people. Our families tend to isolate. They don't want to talk about, we have a loved one suffering from substance abuse. Those suffering from substance abuse itself don't want to talk about it, and they hide it out of shame. And we have to overcome that and that negative stigma so that we can come together as a community, embrace those who need it most. That includes those suffering from this disease, as well as their friends, family, and loved ones, and especially the children who are much like myself and my younger sister, who felt abandoned, who felt ashamed, who need help, who need to be brought up, who need to be given resilience so that they can overcome the issues that substance abuse has wrought in our state, especially the eastern portions.
So there's no doubt that your personal background made you even more determined to tackle Kentucky's major issue with drugs.
Absolutely. So growing up the way I did and becoming a physician, I decided, look, I got to do something to help Kentucky. And that's the reason I took some time off for my training to pursue a degree in public health. That's why I ended up pursuing a job at the cabinet and eventually became the Commissioner of Public Health, because I knew that would give me an opportunity to serve Kentuckians in the most meaningful way possible. But also, I being someone who has experienced this firsthand, who identifies myself truly as a Kentuckian, I felt best positioned to serve.
Let's talk about the opioid crisis. Our first responders run to overdoses all the time. That we were using this the drug that brings them back, the Narcan and so forth. The deaths are about twice the number that are killed in car wrecks here in the Commonwealth. How did we get here?
So I think first thing is we got to put this epidemic in perspective. And what I always like to say, this is an epidemic of epidemics. And I think at the root of this is social despair. You've heard our governor talk a lot about why are we having more gun violence. I think all this is related to the despair we're seeing in our communities, and that we need to address that underlying issue. And once we do, I think we'll see some issues like gun violence decrease. I think we'll see some issues like substance abuse decrease. But let's talk about the toll that substance abuse takes on our state. Almost 1,600 people overdosed and died last year from substance abuse disorder. That's almost 4 Kentuckians a day. Every 12.5 minutes, 12 and a half minutes, an American dies from a substance abuse related overdose death. So this is a tremendous cost. But that doesn't reflect the number of families, children, and neighbors, loved ones that are negatively impacted by this disease, much like I was as a child. And so that needs not to be underestimated.
Are providers these days doing a better job of being cautious in their prescribing protocols? Is that something that is of great concern to you?
So as you know, in the state we had a 3-day prescribing limit law passed in the last year. It was actually passed 2 years ago and enacted. We've seen fairly well that has been implemented by our physicians. But let me tell you, being a physician out there in the community working, our physicians are trying, and have been for a while, trying to limit prescriptions. Actually, the data on America as a whole shows 10-year prescribing rates have decreased over a 10-year period. But overdose deaths have, in an inverse proportion, are increasing because people are transitioning to illegal street drugs.
Many community leaders, tell us they just don't have the resources to be able to try to provide the sort of long-term treatment that is needed for people to really kick this and leave it behind. What is the Commonwealth trying to do? I know there are some websites, some efforts, some information that people can get. Are we doing enough to directly deal with this head on?
Well, let's start from the top down. From the federal government and Trump administration had put $6 billion into the federal budget for the next 2 years. So Kentucky's getting $32 million from the federal government. That's going to be it's going to be doled out through our Department of Behavioral Health through the state opioid response efforts. Also, Governor Bevin put $30 million in his budget. Some of that is now going to the Office of Drug Control Policy after the legislators passed their budget. And so we're going to see unprecedented levels of funding for substance abuse in Kentucky this coming year. So what that means for people out there is there's going to be more life-saving drugs like Narcan. There's going to be more access to medical assisted therapy. And people are going to be able to get the help they need to a greater degree. What I think people also should know is the resources that already exist and are being implemented that are available to them. That includes the Find Help Now, ky.org website, our call line, which is advertised on CHFS's website, and other resources in their community that they can reach out to. The health departments are always a good access point for people looking for resources. Another thing that gets underemphasized sometimes is our harm reduction programs. So that may be for folks who are not quite ready to enter treatment, but understand what I'm doing is impacting me negatively, impacting my community negatively. How can I decrease that harm? And so they can visit our harm reduction programs and perhaps get tested for hepatitis C, HIV, and get linked to care. And if those people want to seek treatment, we have people with those programs who can help them get to treatment.
This has so many tentacles, doesn't it? I mean,
it's an epidemic of epidemics.
Yeah, which was the term that you used earlier. Do you see light at the end of the tunnel?
I do. I think eventually we're going to see this start to decrease. I think what has to happen to get us to that point is we have to decrease the stigma, though. We have to understand from a scientific perspective, this is a disease. The folks who are suffering from this disease don't think clearly. Their brain has been hijacked. Studies have shown this. They don't make decisions at the level of a normal adult. And it's because their frontal lobe, where we make our higher level decisions, is negatively impacted from substance abuse.
How frustrating is it to you from where you sit in your position to know that, we had the pill mill bill, that law that was passed some years ago, and that sort of got addressed. Mm-hmm. Heroin came along. Mm-hmm. That is being addressed. Now we have the fentanyl problem. Absolutely. That it seems that when one thing goes away, something else pops up as a challenge.
Well, I think to keep in perspective, this is illegal drugs is a big business, right? For example, we learned from some of the work done by our congressmen that you can buy illegally fentanyl or heroin overseas, have it mailed to you, and then reproduce that and make millions of dollars from it. So there's a market there for illegal drugs, and I think our folks in the Office of Drug Control Policy are doing a fantastic job of trying to stamp that out. That's the reason we have to continue to support our law enforcement as they're trying to decrease the streams of illegal drugs that are circulating in our communities.
We're visiting with Kentucky's Commissioner of Public Health, Dr. Jeffery Howard, here on Kentucky Newsmakers. More questions about more issues coming up when we come right back. Welcome back to Kentucky Newsmakers from WKYT, and we're delighted today to be visiting with Dr. Jeffery Howard. He is Kentucky's Commissioner of Public Health, responsibility in all 120 of our counties. And as we know, as Kentuckians, there's a lot going on, a lot of challenges. Dr. Howard, how do we deal with the long-term culture of poor health and health neglect in Kentucky, behaviors that lead to all sorts of troubles? Smoking, poor diets, little or no exercise, and the results that come from that?
Well, that's a fantastic question, and one that we're constantly grappling with at the Department of Public Health. One of our core missions is disease prevention. And in fact, that's a core mission for all of public health, not just Kentucky's Department of Public Health. And part of that is we're trying to educate people on health behaviors. That includes the choice to smoke, the choice to not exercise, the choice to not eat healthy. So we're trying to make sure that Kentuckians are aware of healthy choices and that can impact them long term. It's undoubted that Kentucky has an issue with chronic diseases, and it affects our state in many, many ways, not just individuals' level health, but it's affecting our population as a whole. It's decreasing the productivity. And to that end, we're going to be doing something interesting this year from the Department of Public Health. We're going to be producing a Health and the Economy report. First time that we know of that's been done, and I think it's going to shed an interesting light on how health of Kentuckians has long-reaching effects into terms of how productive we are as a state, what individual income levels look like, and how that impacts their personal health.
I guess it will look at absenteeism, disability rates, that kind of thing?
Absolutely, absolutely.
Right,
and we have some very bright people at the University of Kentucky in conjunction with some other foundations who are going to be helping us with that. So we're very excited.
See that report about when?
We're hoping, and I'm pushing to get it before the legislative session, so before January. I probably made them awful nervous telling you that.
All right. Well, you have to come back and let us know some results.
Absolutely.
The hepatitis A outbreak hit Kentucky really hard, the worst in the country, apparently, with cases. Louisville has the worst situation, hundreds of cases there, but there are also cases in rural areas and it's scattered around the state. Are we getting a handle on that?
I think we are. We knew early on that the hepatitis A outbreak was going to be difficult for Kentucky. We have a baseline population who aren't as healthy as some other states. We have a severe substance abuse problem. This outbreak tends to spread, at least in Kentucky, through homeless people who are homeless or people who are substance abusers. And so we have problems with substance abuse especially. We have 1,276 cases in Kentucky as of this week's report. Again, the risk factors are as I told you. It was primarily located in the Louisville metro area. Louisville Metro is an independent health district, but we worked very closely with them, and their director, Dr. Sarah Moyer, is a very bright physician who is good friends with myself, and she and I communicated regularly and coordinated a plan. From a state level, I've been concerned about what's this look like as it spreads into eastern Kentucky, because the resources may not be there to respond to the degree that it is in a Louisville Metro. And so we've been trying to engulf those areas in resources. That includes physical funding.
Well, yeah, we had reports that there were some counties that couldn't get their hands on vaccines, for instance, in eastern Kentucky. I mean, is that, you're aware of that, right?
So there was a couple folks who we signed up on a what's called an MCAP. It's a multi-purchasing agreement to allow them to buy vaccines at a decreased rate. The provider, which is Merck, who's been a tremendous partner in this outbreak, had reached their allocation for a 2-week period. At the end of their fiscal year. They're going to be reallocating vaccines. We don't have a vaccine shortage, though, and I don't want people to feel that way.
Back to school time, some vaccines and screenings are required of kids right now, and it's an important time for that.
Yeah. So this year, particularly, we had a hepatitis A vaccination required based on the new state regulation that was put into effect last year. So children had to have the hepatitis A vaccine. That caused a little bit of a stir, but what most folks need to know is that most pediatricians have been vaccinating children for hepatitis A since early 2000s. It's been standard of care. So most kids have had the vaccination, they just need to bring proof of documentation.
The flu season was tough and deadly last year. The flu shot was said to not be a good match. Are you encouraged at anything you're hearing about this year's version?
Well, what I would say regarding the flu itself is I anticipate another difficult flu season. We're watching closely what's occurring in the southern hemisphere. Our flu season follows the southern hemisphere's flu season, so what we're seeing is they're having a difficult flu season. Turns out the flu vaccine was about a 30 to 40% match this year after it was all said and done, and I think we'll see a similar episode in the future. There's some new science coming out on vaccines that may make it more effective in the future. I don't think we're going to get that coming for next year. we're going to partner with the Kentucky Medical Association and the Department of Public Health to increase awareness, and that's going to be coming to people's doorstep soon.
Another major part of your job is disaster preparedness. We have the New Madrid Fault that would affect western Kentucky should there be an earthquake. We've seen tornadoes and ice events that have been crippling. How much effort do you put into making sure the state's ready for the unforeseeable?
We have a tremendous staff who just focus on disaster preparedness, and some of that is things that you wouldn't even think about. It's inspecting your restaurants, it's inspecting radiation dump sites and protecting people from those issues. But also we have people who meet regularly, discuss the New Madrid Fault, discuss issues that are similar to that could be disasters for Kentuckians. For example, we're constantly monitoring the weather and taking reports from guys like you so that we can help Kentuckians be prepared in the event of some unforeseeable damage.
Do we have a shortage of healthcare providers in the Commonwealth?
Well, we could always use more healthcare providers, especially in the primary care fields, especially in rural and eastern Kentucky. We are seeing more and more providers at the mid-level, so physician assistants as well as nurse practitioners, but we need more physicians to move in that area to help support the needs of that population.
Dr. Howard, thanks for coming. Really do appreciate you answering our questions, and hope you'll come back. And we hope you'll stay with us here on WKYT's Kentucky Newsmakers. We'll look at a piece done this week by WKYT's Sam Dick about how the new service tax has hit charities. And we'll also have some highlights from Fancy Farm coming up. Welcome back to Kentucky Newsmakers, and we're glad you're here. The state legislature was in a hurry last spring to pass a budget and try to address the state's pension crisis. Republican lawmakers finally settled on extending the state sales tax to some services as a way to bring in some more revenue. Now there's some unexpected fallout. WKYT's Sam Dick has more on that.
This is amazing. I love this project. I love all the projects that we do, but when you get
Habitat for Humanity is celebrating its 30th year of building homes in Lexington, totaling more than 450 houses, like this one on Ash Street.
When you get this close to it being finished and know these families are going to move from these dire conditions.
But Habitat's 30th anniversary comes at the same time nonprofit groups across the state face a big challenge, one they're still trying to figure out how to handle. Effective now, every ticket sold to a gala or fundraising event is taxed 6%. So for their golf tournament this month, Habitat is absorbing the taxes on all the registrations.
You're talking about 6% of 24 golf teams that are $1,000 a piece, so it's not an insignificant number.
There's a lot of frustration, some anger, concern and anxiety. How is this going to impact our fundraising?
Danielle Clore is executive director of the Kentucky Nonprofit Network, representing hundreds of charitable groups.
A lot of organizations are very small. They may have 1, 2 staff persons. So they're out now hiring CPAs to guide them and really having to revamp all of their practices.
Taxing ticket sales to nonprofit events is just the start. If you sell an auction item at an event, a gala for a nonprofit, that can be taxed. And then there's sponsorships. That's a big one. If you sell a sponsorship to a nonprofit gala and it involves hospitality like food and drinks and blocks of tickets, the sponsorship can be taxed. And not just part of it, but the whole thing.
It's going to hurt charities and it's going to hurt people, and we've got to put a stop to it.
Stuart Perry works on many charitable events, including the Kentucky 3-day event held in April at the Kentucky Horse Park.
4-star event, largest horse event in America in this kind. So when a rider makes an entry, 6%. Every ticket, 6%. Every sponsorship, and we have sponsorships upwards of 6 figures, 6%. So it's hurting us severely.
Tickets to nonprofit events and the sale of auction items have been taxable for decades, but the Revenue Department never enforced it. Now they are. A month before lawmakers passed tax reform in April, the state Supreme Court ruled that nonprofits were not exempt from collecting taxes on admission tickets.
The Supreme Court decision addressed the issue of admissions, the sales of admissions, and it clarified that nonprofits are not exempt from, their sales of admissions. It's not like the department arbitrarily said, well, this is a decision to tax these things, but we have to administer the tax laws according to the law of the Commonwealth.
Legislative leaders say their tax reform never intended to include taxing nonprofits.
The court decision definitely made it unusual. I think that had it not been for the court decision, there would have been no reason for revenue to interpret anything differently than the way they've been interpreting it over the years.
The Speaker of the House has pre-filed a bill to exempt nonprofits from paying taxes on admission tickets, but it will be next year before lawmakers can address it.
It's been a tricky mess.
In the meantime, CPAs are working with nonprofits to deal with the new tax. And yes, that includes churches selling tickets to fundraisers.
If you're selling a ticket to something, I think the answer is yes, regardless of who you are. And I don't think that's a constitutional issue. I don't think that there's a separation of church and state problem there, because the tax is really passed through to the person who's purchasing the ticket.
All right, appears to be an issue that will be addressed by the legislature this coming January. Now, some highlights from Fancy Farm, which was last weekend, where Kentucky campaigns really get rolling. Governor Matt Bevin was not there, neither was Senator Rand Paul, but Majority Leader Mitch McConnell was. He spoke to the crowd from the stage, so did candidate for governor Andy Beshear, and Secretary of State Allison Lundergan Grimes, who left many wondering what her next move might be.
You know, Father, I've been preparing for my visit to the parish by performing as many confirmations as I can. Only mine are a record number of federal judges. The two reasons it's so great to come here, one is the barbecue, and the other is this is the only time of the year you'll see any Democrats in Western Kentucky. There's a lot of good news to celebrate. Good news like how unified Republican government has strengthened the economy, how Kentucky's unemployment rate is the lowest point in 42 years, how under the governor's leadership there are more than 40,000 new jobs and $15 billion in new investment in our state. And there are some distinct advantages for having me as the Majority Leader of the United States Senate. I'm in a position to take special care of Kentucky. And so here are a few examples. As you've heard before, Kentucky farmers want to grow industrial hemp. So I included a provision in the Senate version of the Farm Bill to legalize industrial hemp. I'm grateful for Congressman Comer's support, and soon President Trump will be signing this new farm bill into law, making it possible for us to grow hemp. And here in Kentucky, we're worried about the Asian carp in our lakes. I wanted to stop the invasion, and I recently put a lot of money in a federal bill to go after Asian carp and protect our lakes. When Kentucky coal miners needed someone to save their health care, I stepped in and did it.
You know, a lot has changed for me since I was here last year. My kids are taller, their homework's longer, and thanks to this side of the stage, I had to pay 6% more just to fix our minivan. Speaking of taxes, last year I released my tax returns on this stage. This year, we released them in April. Last year, I fought Governor Bevin's attacks on public education. This year, we defeated that sewer bill. Last year, I was here as your Attorney General. This year, I'm also running to be your governor.
With all these no-shows on the Republican side today, I'm not sure who has more chickens, the GOP or Colonel Sanders. Let's talk about the big news first. How do I put this? Father, if the Republican Party goes crazy about a photo of me driving nearly 90 miles per hour again, well, it's because my water broke. Not only am I having a baby this year, but I also have a big birthday. 40 will not only be my age, it's Matt Bevin's dream approval rating. It's 15 years too old to be a young Democrat and apparently 40 years too young to be in the United States Senate. I want you to think about this. The year that I was born, there was only one woman in the United States Senate, or as Mitch calls it, the good old days.
That's been an honor serving as your state auditor, especially for that individual over there who loves me. And I'm so proud of our office. We as a team have done some very important work, including just recently a historic first ever outside examination of the administrative office of the courts. Now, we found some serious issues with their operations and their lack of policies. One example was leasing office space for a Supreme Court justice from a company owned by his sons without a documented explanation as to why it was chosen, even though it was 3 times higher than another option. Now, there's a lot more in that one, 20 altogether findings, but you'll have to go to auditor.ky.gov to see. Now, and we are always keeping a watchful eye, trying to make sure government is efficient, effective, and ethical. With that in mind, we have worked with members of the General Assembly on several pieces of legislation, including Senate Bill 144, sponsored by Senator Stan Humphreys. And this bill should help many of our sheriffs and county clerks save 25 to 50% on their audits. Common sense solutions that save our counties money are good policies on both sides of the political aisle.
And that is Kentucky Newsmakers. Thank you for joining us. Make it a good week ahead.